Well, hello, everyone, and welcome to another edition of Woundcare Pro with nurse practitioner Anne Walsh. Today, we are going to be focusing on skin tears, and this is especially important for those who are on blood thinners who have very thin skin. And I know from experience with my dad being on dual therapy, he had tear after tear after tear. So, how do we prevent these skin tears? How do we treat these skin tears? What do we do about them? Well, that's what we're going to be talking about over the next half hour. So, welcome, nurse practitioner Anne Walsh. Thank you so much for being here and always being willing to help us out with our wound care needs.
Great to be here.
So, what I think we just go basic. I mean, skin tears. What exactly is a skin tear? Is that just a glorified way to talk about a cut or a scrape, or is it something just a little bit more?
Yes, the skin actually separates. So the two layers, the epidermis and the dermis, separate from each other, or both can separate. And it can be pretty, scary looking. What I've seen a lot of skin tears in elderly folks. I had a patient who was 100, and like the whole arm was basically like sloughed off. And something as simple as somebody's turning her in bed, but her skin is just so fragile. She's on these medications, like you said, and it's very frightening for the family and painful, frankly, for the person.
Why are they such a significant concern in healthcare?
Yeah, I mean, as people are aging and living longer and on all these medications, whether it's steroids and blood thinners, like you said, the skin takes a hit. It gets more fragile, thinner as we age, and these medications are added on, and they bruise easily, could get bleeding under the skin.
Yeah.
Even people younger, if they're in critical care, let's say, the skin is so fragile, it can happen quite easily.
Yeah, so the primary risk factors for developing these skin tears basically, that you're older, that you're on these medications and that kind of thing.
Absolutely. Multiple comorbidities, or it could be a neonate, somebody very young and just fragile and the skin's not fully developed, also at risk. And somebody
Yeah.
who's not eating and drinking enough fluids, your lifestyle could impact and increase the risk.
So are there specific areas of the body that are more prone to skin tears and why?
Yeah, mostly we see them on the arms and legs, just, patients, especially if immobile, little mobility issues, let's say, vision issues, maybe unsteady on their feet, they could bump their arm more easily. Just, using different tools or whatever, they could cause an injury that way. If they using adhesive on the skin, get a little cut, and then you take the Band-Aid off, for example, now you get this big skin tear. So it's, and the legs, if you bump your legs or you have some vascular issues, the skin is very thin and fragile. One little bump, getting out of bed, bumping against a wheelchair, could cause a significant injury there.
So how does the use of blood thinners, and you touched on it, impact the likelihood of these skin tears? People want to really understand the mechanism of action because, for example, usually it starts where your arm ends up red. And so they want to really understand, well, one, why does it end up red? And then two, that would, talk about how that increases the likelihood of these skin tears.
Yeah, so somebody's already has fragile skin, whether they're advanced age or on steroids or what have you, then you're on a blood thinner, the skin just bruises so easily. I mean, sometimes you barely, touch the skin and it's bruising. So then it just really sets a stage for that skin kind of getting even thinner and more fragile and just opening up. And some people are just genetically, I have friends of mine, like, oh my God, I barely touch anything. How did I get this bruise? They don't even realize how it happens, that maybe they're a little anemic or something, and the skin bruises and could just break easier than the next person.
You were mentioning a little bit ago about the importance of hydration. So I'm curious about the role that nutrition may actually play in preventing skin tears.
Yeah, definitely. So if somebody's not drinking enough fluids, the skin gets very dry, and this dry skin could break down much more easily. If somebody's, excessive alcohol even could dry the skin. If somebody's
Mhm.
bathing excessively and using, harsh soaps, that could dry the skin and also lead to injury. If you don't have that oiliness of the skin, and just like it just could crack and again tear easily if somebody's not either hydrating, both moisturizing the skin and also taking enough fluids in.
So overall, let's just run through prevention just in general.
Yeah, so just, being careful with the skin, try to give good nutrition, hydration, moisturizing, because again, if the skin is dry, it's more apt to break down. And best time to moisturize coming out of the shower, skin's a little moist. Then you can put
Mhm.
the moisturizer on to kind of hold that moisture in there. Um, just,
Just
even
not between the toes.
just not between the toes, you're right. And also keeping the sugar under control, because if somebody's diabetic and they have high sugar and they're urinating a lot, more risk of dehydrating. So just, keeping an eye on, your comorbidities, keeping them in check, and nutrition, hydration, and a good skincare routine.
Yeah, and that's really important. But you would imagine that the healthcare professionals would be a little bit more assertive in terms of making sure that patients know that they're at risk of these skin tears. And I just don't think that they are. And that's why we have so many here in the live studio audience that are like, what are skin tears? Really? What's that all about? But how can healthcare professionals accurately assess a patient's risk for skin tears, and what should they be doing about it during regularly scheduled appointments?
Just, if they're the ones prescribing, let's say, steroids, blood thinners, you should have a conversation. Those are part of the side effects of these medications, just to encourage good practices with the skin. Like I said, moisturizing and all. And it drives me crazy if I see somebody has, let's say, a wound on their foot and somebody tapes the gauze in place. And now, the wound itself is
Yep.
like less of a problem than the skin tear from the adhesive. So, usually I'll use a gauze wrap or something like that, or these mesh net, stockinettes to hold the dressing on without putting adhesive on the person's skin because they're already at risk. And, and then if you have to use adhesive, there are silicone-based adhesives. They're much more gentle on the skin. So it just, using good practice if somebody does have a wound to try to prevent not, having something else happen from the actual adhesive we're using.
And we just had Joyce write in and says, whoa, wait a minute. That sounds familiar. So she went and had a revascularization done just a couple of days ago. It went well. They gained access pedal, meaning they gained access to her arteries through her foot and came up to tackle the blockage from below. And she just went and took off the cover
Uh-oh.
for her wound, the access point, and it's just completely ripped the heck out of um her heel. What does she do about it now?
I mean, if it's superficial, you may want to put something like a topical antipoint, like a bacitracin, let's say, for example, if you have no allergies, if it's superficial, and try to avoid adhesive on that skin. If you can,
Yeah.
use a non-stick dressing and maybe some kind of gauze wrap to keep the dressing in place versus the tape.
And that is really important. When my dad ended up, he was on the dual therapy, and his arms were just completely red, the bruising up and down, and you would look at him and he would get these skin tears. And
Yes.
I mean, that's how sensitive his skin was. We couldn't use Band-Aids. They told us absolutely not, don't put Band-Aids on that arm. We're like, what do we do? And so we wrapped exactly what you said. We got some gauze, the wrap, it's the beige stuff, and we got a roll of it. And so what we were able to do is we were able to put a silver dressing down and then a non-stick one, and then we wrapped that around it, and then we taped that. We put the tape on top of that, which seemed to work really, really well.
Absolutely, yeah, and they do have, like I said, silicone tapes if somebody needs it. Because we've had some patients who have a skin tear, let's say, on their hip because they had a dressing and then somebody ripped off a very
Oh,
harsh tape. Now you got a skin tear over there. You need something to hold a dressing on. So we use silicone, let's say, foams, and this tapes comes off very gently. I tested on myself. You put it on the hair of your arm, and it just comes off. You don't feel it. So using something like that and trying to use a dressing that could stay on a couple of days
yeah.
where appropriate. So you're not pulling something off every day, which is going to add up and cause a problem.
So these skin tears are so prevalent. When I was doing some of the research on this, I was shocked. There's actually ISTAP, the International Skin Tear
Oh, yeah.
Advisory Panel. I didn't realize it was that big. So you not only have the panel, but you have the ISTAP, am I pronouncing it right? Classification system. Can you talk about that and how it's used?
Yeah, it's a really great organization. I should include it in my app because it's just you could tap on the resource, go there and have so many resources. And yeah, they just talk about, partial thickness or full thickness, depending on if somebody gets a skin tear. It could be the first level of the skin,
Mhm.
the epidermis, or if it's deeper, it could be the epidermis and the dermis. So it's considered full thickness. So just a way so we're all on the same page as far as like how much of this is happening and the treatment options available. But it's a great place for, patients, for clinicians to go on and just learn how to classify these and how do you treat them, how do you prevent them. It's a really good resource.
Are there any emerging technologies or products that are designed specifically for skin tear prevention?
Well, I know for prevention, but there are like skin cleansers
Definitely
that
ones
are
for
like
treatment,
less
right?
harsh on the skin that you could probably, prevent, and a lot of treatments to prevent, skin tear from happening. If somebody has a wound and you want a non-adherent dressing, and again, these other ways of holding the dressing on without using these harsh tapes.
So what is the recommended approach for actually cleaning these skin tears?
Yeah, a lot of times I'll use wound cleanser or normal saline, which is basically salt water, or you could use just mild soap and water, depending on the
Yeah.
situation. Something without deodorants, alcohol in it, or harsh chemicals like Dove, and they have other ones that are actually skin cleansers that you could get over the counter, and just like very gently, and not to use harsh hot water where it's going to over dry your skin. If you're in the shower, you could just use plain warm water and with a mild soap.
When do you need to use like a bacitracin or neosporin? Because we got into the habit of actually, one of my dad's care doctors said, you know what, unless it's actually infected, you just rinse it as you said, and then you just put a nice non-stick sterile silver dressing over it. And he's like, well, what about the neosporin? She says, no, absolutely not. Why is that?
Yeah, because you don't need to use an antibiotic if there's no sign of infection. And sometimes Neosporin has some ingredients that some people get like, sensitivity to it and maybe get
Ah.
red because of that. So we try to avoid them. I mean, we use it sometimes where I've seen patients fall and they have across their forehead these skin tears that you can't hold dressing on. So sometimes the easiest way, a little dab of bacitracin, leave it open to air, and they seem to tolerate very well, a case by case basis. Or if you're putting a non-stick, like a Vaseline gauze, sometimes on some patients it does stick. So sometimes if we notice that, we soak it and remove it. And next time we put bacitracin on it to make it extra greasy, and then it works
Yeah.
fantastic. So it's a case by case, but normally, we use hydrogels and Vaseline gauzes and other products that won't stick and not necessarily jump to bacitracin or Neosporin.
So, what are the potential, let's scare everybody. What are the potential complications of untreated or improperly managed skin tears? It's so important to know. You can't just
Yeah, I
brush them.
mean, yeah, infection is always a risk. So if you have this skin that's open, and skin is supposed to protect us, from the elements and germs and all that. So if it's opened, there's a risk of infection. But if you good skin care and good wound care, that should prevent that. But it's always a risk. And then of getting, scarring and this and that, if it doesn't heal properly, if it's not kept, moist, not too wet, not too dry, then it may just like scab over and be constant open and closing and cause discomfort that way.
Is there any difference in skin tears across generations from the young to the elderly?
Yeah, I mean, the elderly, sometimes we see some severe ones, and when they close and another one opens up, they're falling, they're bumping their arms, sometimes being transferred out of the bed. The caregivers, if they're not too careful, the patient may bump their leg or their arm on a Hoyer lift, and I've seen some horrible wounds. Or I've had one patient that actually the wife was taking off his bandage off his leg, and she didn't use a bandage scissor, so the sharp point is going like this, going down along to remove the bandage, and he's like, "Ouch!" So when I came in to see his wound, he had this huge skin tear, and she was like, "Oh my God!" So we ordered bandage scissors because one side is blunted, so that you could cut off the bandage if you had like a compression wrap, let's say. So we see a lot of it. I had one lady that she was very agitated, and she was like grabbing her own arm, and she gave herself a skin tear. It was like her whole arm. She was 102 years of age. Her skin was so thin. But she went on to heal as well, but it's painful for the person, um, and a risk for infection.
Can we do anything to thicken our skin as we age, aside from hydrating?
I mean, hydrating, good nutrition, and then sometimes you see all these things advertised like collagen topical and vitamin C topical and all that. I don't know, how much is how much it's worth, but definitely nutrition, hydration to help keep the skin as supple as possible.
Yeah. And how about you're mentioning that to get those scissors that are more blunt, to take off general bandages, but what about just a band-aid? And what if you know that your skin is really thin and you're like, oh no, I just had an IV in my arm and I now have a bandage. They put the sticker on it, and I don't know how I'm going to get this off without tearing my skin. Do you get it wet? But some of the bandages, some of the newer bandages, they actually get stickier when you get them wet. So what do you do?
Yeah.
How can you get them off safely?
I mean, there are adhesive removers, and now they have alcohol-free ones. They come as a pad. Looks like an alcohol pad, but it's no alcohol, and it smells like acetone, like we have nail polish remover. And you could use those to kind of take the tape off. The patients with ostomies, they have
Mhm.
a wafer stuck to the skin, so sometimes they're very sensitive. So a lot of times they'll use that and just kind of you wiping it as you're peeling off, and it takes off the adhesive that way. And just some, companies will tell you how to take their bandage off. They'll say stretch it from the side so that it sort of lifts up rather than just ripping it off. So sometimes it's technique, and sometimes that you can wet it if the actual gauze is stuck to the wound, whether it's wound cleanser or soak that and remove it and hopefully get a different treatment next time if that's happening. I've gone to houses where I'm there for an hour trying to soak the dressing to remove it. Say, okay, we can't use that anymore. If they came to the hospital to us and the person's in so much pain, and then we just soak it, soak it, soak it, remove it, and then get like a non-woven gauze versus a woven one or whatever we have to do to change the treatment.
I would imagine with so many people across our nation, that are aging and also on so many on blood thinners, I'm probably imagining that there are some pretty big economic implications of skin tears for healthcare systems. And is there any research that's currently being conducted to improve prevention and treatment strategies for these skin tears that you know about?
Well, it's definitely lots of education out there and lots of companies coming out with the dressings that won't stick or hope they won't stick. And it also could stay on up to 7 days. So you're not pulling this dressing off and that
Mhm.
it would maintain the moisture and that sort of thing. But I think, all of us, at my company as well, we're always educating the staff on a proper technique. And if we get a patient to us and we see that adhesive on the skin, the person has poor circulation, we use that as a teachable moment. Um,
Mhm.
to like prevent that from happening again. But a lot more
Fantastic.
needs to be done, of course.
Did I miss anything? I think we really covered skin tears
Well,
from
another
beginning to
point too, if somebody's incontinent and they're bedbound, the skin is constantly exposed to moisture from
Oh
incontinence.
yeah.
They're at risk as well. So for those patients to have a moisture barrier ointment or cream, hopefully seal out that moisture because you want the skin moist, but not sopping wet where it's macerated either.
Hmm. And there's a lot of those creams that you can get. I never know which one is the best one to get, especially, for example, to prevent bed sores or any sort of, for thin skin. What would be the difference? I mean, is there a difference between the bed sore and the skin tear, or can a skin tear be a bed sore or from a bed sore?
Well, it's really what led to it. So if somebody's, in bed, they're in a pressure point, they're not being offloaded, turned and positioned enough, they may develop a pressure injury. Sometimes somebody will call that a skin tear, but when we dig deep, I'm like, oh no, that's really from pressure. But they may have a skin tear from the dressing that was put over the pressure injury, let's say, for example. And there's a whole movement on that. It's called medical adhesive related skin injury,
Mhm.
MARSI. So everyone's trying to prevent those. So educating people, okay, this is what we're doing for the wound. Let's not cause problem to the peri wound, from adhesive or from other injury.
And we have Robert, who is on watching on YouTube, and he's with Pad Life Outdoors. It's a great YouTube channel if anyone wants to look that up.
Oh.
Robert Castleberry, and he's wondering, so for those people with, who are susceptible to skin tears, who love to hike, they love the outdoors, any thoughts on prevention for when you're out there exposed to the elements?
Yeah, I mean, again, moisturizing the skin will hopefully help, and also wear maybe long sleeves versus short sleeves as you're like the branches are rubbing against and leading to a skin tear. Again, that hydration, bring the fluid with the water bottles and good protein and multivitamins and all that stuff if you're not getting it from the diet.
And we have Frank who's here. Frank, I just wanted to share for a second that his skin tear is getting a little bit better. Frank, do you want to unmute and tell us about your skin tear? Is he still? Yeah, there he is. Hi, Frank.
Hey,
Hi.
hi,
Good
glad
to
to
see
join you.
you.
Hi, Anne. How are you?
Good, how are you?
Okay, yes, I am actually wearing a prosthetic, an artificial leg. I believe some friction created a tear, actually, some type of irritation or ulcer. And it's been months. It's been quite a while since I'm diabetic as well. It's taken a while to heal. But just most recently, earlier in September, I visited a wound care clinic and got some zero foam. Is that what it's called?
Yes, yes.
Okay, I didn't have that before, but now it seems that the zero form is taking care of closing ever so slowly, closing the wound. So I expect it to be healed within weeks. So that's
Oh,
the
that's
good
great.
news.
That's
But
great.
it took longer than I thought. I believe my primary care wound care nurse from my regular clinic wasn't able to produce zero form for me. So that was my case.
Yeah, and if you're putting pressure on every time you're ambulating, it's probably in a tough spot. Is it? Is it constantly rubbing? Or,
Well, yes, again, up until early summer, I had no trouble. So it must have been in some kind of unexpected friction point within the socket, the prosthetic. Unfortunately, I cannot be sitting around
no,
for
no.
extended periods.
Yeah,
So I'm in
yeah,
that dilemma between letting the residual or the stump heal
yeah,
and actually bandaging it correctly.
yeah.
What's your opinion on the foam padded regular bandages from McKesson and other providers?
Yeah, we use a lot of the silicone foam, so it's nice and cushiony, and it doesn't cause all that roughness with the adhesive part of it. We actually use those a lot, and they could stay on up to 7 days depending on the situation. Or you could lift it up, look at the area, and stick it right back down, because they could be costly, of course, as well, but they work nicely.
Yes, I was depending on those until again I visited a full-fledged wound care center and got the gauze wrapping you referred to earlier in the half hour.
Okay,
So now I'm learning how to gauze instead of bandaging,
okay, there you go.
and that's that. Thank you for having me on.
It's great. I'm
Yeah,
glad
and
you're almost
you're
healed.
doing a good, sounds like you're doing a good job, right? But
Yes.
just I'd love for you to take a second as we wrap up here, to talk about the importance of making sure that you are, if you do have a wound, that you are actually going to a certified like wound care center or someone who's certified in wound care.
Yeah, I mean, if you have access to that, or if the person who's coming in, if the agency has a wound ostomy, or somebody who specializes in wound care, that's important. I get about probably 20 consults a day from nurses that are out all over seeing patients. I go to see some patients myself. Others, I'm getting pictures, and I'm able to give recommendations and go from there. So even if the person isn't physically there, they could at least look at the picture of your wound and say, okay, are we doing this, this, and this, and make sure there's a good plan in place.
And make sure that you also have your clinician, whoever it might be, download Woundcare Pro because it's a great resource for you. So if they aren't certified, it is always kept up to date by Anne Walsh. She is literally on there making sure the most up-to-date information is on there, the latest publications and all that jazz. And you can find Woundcare Pro. You can download it from either the, what is it, the Google Play Store or the iPhone Store. Apple Store. So make sure you do get it. It's only $4.99. Physicians, clinicians, caregivers, even patients can download it to make sure that you have the right information to care for your wound. Because if you're not caring for that wound, it can get out of control very, very quickly, become infected, and ultimately it could become limb threatening or even life threatening. So very important, right, Nan?
Yeah, yeah, definitely. Yeah, the zero foam we use a lot for skin tears, and that's in there. I put a picture of it. I describe, what you do with it, and a section on skin tears. So for clinicians that don't know, they could at least look it up, and they could order it for you. Yeah.
Thank you. Thank you, nurse practitioner Ann Walsh. So what are we talking about next week?
What should we talk about? Should we talk about maybe nutrition and wound healing, or any other topics anyone's interested in?
Yeah, anyone who has a topic to that wants to speak up, but I do like nutrition and wound healing because It is such an important topic. We were talking before this program about one of our patients who's down in Southern California, and he had just gotten out of the hospital. He's like, I want Costco pizza. I want Costco pizza. And he has this wound on his toe. And I'm like, you know what? Every bit of what you put in your mouth is critical for wound healing. So you really want to maximize nutrition and protein and whatever else that you might share with us next week. I think that's a great idea.
Sounds good.
So next week, right here, youtube.com/the way to my heart, we're going to be talking about nutrition and in wound healing with nurse practitioner Anne Walsh. It is going to be really fun. I have not posted it, of course, yet. So if you want to get notified for every single time that nurse practitioner Anne Walsh is on and we talk about how to heal all kinds of different wounds, and you want to be able to ask your questions of nurse practitioner Anne Walsh, make sure that you like our channel, you subscribe to our channel, and you'll get notified when we put up new notifications for when we are going live. So thank you so much, everyone, for joining us. And thank you so much to Anne Walsh. And don't forget to download Woundcare Pro.
Thanks, everybody.